thank you all for joining us. Today I will be joined by Bob McDonald, Executive Director of Denver Public Health and Environment, as well as the Regional Public Health Directors from Adams, Arapahoe, Boulder, and Jefferson counties, as well as by Dr. Bill Berman from the Public Health Institute at Denver Health and the CEO of Denver Health, Dr. Robin Wittenstein. Before we begin, and in the spirit of today's announcement, I want to let everyone know that everyone here today has been fully vaccinated. So we'll be removing our mask as we come to the podium. I also want to say thank you to our regional partners for all the work, coordination, and effort we've undertook together over the past year and a half. We've all understood that managing this pandemic was not something any one of us could do by going it alone. We needed to move together as a region to close any gaps in our response to this virus. And in that spirit that we're here today. I want to say here at the beginning that Denver's vaccination rate is stellar. We're just under 70% of all our residents being fully vaccinated. 76% have at least one dose, and that number will continue to climb as more of our youngest residents get vaccinated. This rate of vaccination isn't just happening in Denver. It's happening in communities across the metro area because our residents understand why getting vaccinated is important. But that's not the case in other parts of our state. And in the vast majority of those currently hospitalized with the virus, they are unvaccinated. This is again causing a dangerous strain on our hospital systems and threatens a collapse of that system as unvaccinated individuals needing care are transferred to metro hospitals to alleviate pressure on their local systems. If we don't reduce this stress now, the impacts on capacity will mean those who need care, whether they have COVID or something else, could see that care being reduced or even rationed, and that will cost lives. As the holiday season ramps up and more people come to the metro area to shop or gather with friends and families, it's incumbent upon us to take steps to keep our residents safe. So absent any additional statewide measures to address this current challenge, regional protective actions have become necessary to reduce the dangerous pressure on our hospitals. Denver, in alignment with our regional partners, will be issuing a public health order requiring masks in indoor settings for most businesses and venues. If they don't want to require masks, your businesses or venues can also implement a vaccine check before entry into your business. In each case, or which case, masks will not be required. Let me say that one more time because I don't want to jumble it up. Once again, as regional partners, we are issuing what I like to call a VASC or mask mandate. Either your venue or business is requiring to proof of vaccination, or you choose to be a place where only masks will be required. But either or, as a venue or a restaurant or type of operation, we are putting a mandate in place. And I didn't want to screw that up, and we'll further clarify as we go forward. This order will go in effect tomorrow and will be in place through January 3rd. Many of our local businesses and venues are already doing this, and we applaud them for being proactive and keeping their customers and workers safe and healthy. Now, I know it's disappointing that the decisions of some, again, mean additional restrictions on our vaccinated residents. And I certainly share in that disappointment because I know a lot of work has gone into getting us to where we are. But this is the situation before. Wear a mask or get vaccinated. We prefer our residents, of course, get vaccinated and to try to reach that final 25% who haven't done so yet, as well as our youngest kids who are recently eligible. We're going to enhance current vaccination efforts in schools and underserved communities so shots reach those arms. Again, let me be clear. We're not here today because of what we've done in Denver and the region hasn't worked. Quite the opposite. If other communities in Colorado and around the country took the affirmative steps we have taken around vaccines, the pandemic would be under control. But we will do what needs to be done to ensure that we get through the next 45 days without having a break in our hospital capacity, a break the state and the governor have made clear could risk lives. To keep our local businesses running at full capacity, to keep our schools open, and reduce the strain on our hospitals, this is the route we're taking. It gives vaccinated customers the peace of mind that either everyone around them is also vaccinated or masking is in place to help mitigate transmission. If you live outside the metro area and are vaccinated, please consider getting vaccinated so we can welcome you freely into our communities. And if you are vaccinated, don't forget to get your booster shot. They're now available to everyone over the age of 18, 6 months after your last dose of a 2-shot vaccine and 2 months after your J&J vaccine. With that, I'm going to turn it over to our Executive Director, DDPHE, Denver Department of Public Health and Environment, Bob McDonald, to give further clarification.
Thank you, Mayor. I want to thank everyone who was able to make it with us today. I have some slides that I want to share, but I want to reinforce some of the comments that were made by the Mayor. Let's be clear about why we're doing this. This is not a failure in Denver. It's not a failure of the public health system. We are here today because too many people chose not to get vaccinated even though they were eligible. We have been saying this now for 11 months since vaccines were rolled out. They're safe, effective, and the only way out of this pandemic is to get vaccinated. 83% of people that are in the hospital right now throughout Colorado are unvaccinated. And I've heard all the reasons why people don't want to get vaccinated. They feel they have a good immune system. They feel they have, it's their choice. They feel it shouldn't be mandated, that there shouldn't be vaccine passports, there shouldn't be face coverings. And yet we have about 1,200 people right now that said those things and now are reaching out for help in hospital systems because they're too ill, they're having difficulty breathing. So I am still hearing today from many people who are against being vaccinated that they don't work because there are people who've been vaccinated who are in the hospital. We acknowledge that there are going to be breakthrough cases. The more unvaccinated people we have, the more breakthrough cases we will have. But hospitals are filling up by those of you who have chosen not to get vaccinated. And to suggest that the vaccines don't work because some who are vaccinated are still in the hospital, that's like suggesting seatbelts don't work because some people who wear seatbelts and got in an accident still had to go to the hospital. These are safe and effective. And we're here today where everyone now has to mask up. Businesses now have to enforce face covering orders or vaccine passports because of those who chose not to get vaccinated. Hospitals are overwhelmed now because of those who have chosen not to get vaccinated. Let's take a look at where we are. This chart right here says it all. This is a correlation, a graph that very clearly depicts the correlation between hospitalization rates and vaccination rates. You can see that the more communities are vaccinated, the less cases we have, and hospitalization admissions go down. You can see on the upper left-hand corner, the less people that are vaccinated, the more cases we have, and the more hospital admissions we have. It's that simple. Next slide, please. This is not a Denver problem. This is not a regional problem. The region is stepping up to do our part. These are decisions that are not easy to make, but we need to make them. And the Metro Partnership for Health is standing up to do our part, even though we have many communities throughout the state that have lower vaccination rates and higher case rates. So we need all communities to step up and get vaccinated. Patients are being transferred across the state because this is a statewide problem that requires statewide action. Next slide, please. I'm often asked when I talk about case rates, what does that mean about severity? Well, this is very clear. You know, we are right back where we were at the beginning of the pandemic with hospitalization admissions going up, and we have less healthcare providers now than we did at the beginning of the pandemic. So in many ways, we're in a worse spot now than we were at the beginning of the pandemic, and the only way to get out of this long term is to get vaccinated. Face coverings are only a tool to slow transmission. Vaccine passports are only a tool to slow transmission. An unvaccinated person is still unvaccinated when the face covering mandate is lifted. Next slide, please. When I talk about hospital admissions, I'm often asked, well, what's the severity of those cases? What's the mortality rate? You can see this chart here also depicts very well that mortality is going up now. We have to somewhat disregard that tail end of the curve here because that's a reporting function. And so this is the worst case scenario right here. We need to drive numbers down. The only way to do that is to get vaccinated. Next slide, please. So in Denver, and in close alignment with regional partners, effective tomorrow, everyone age 2 and older will be required to wear a face covering in all indoor public settings with few exceptions. Or in those venues, responsible parties can implement a vaccine passport system where they're checking vaccine passports at the door, making sure that at least 95% of people that are in that venue at any point in time are all vaccinated, including the staff that work there. With this order will be in effect until the early part of January. And then just as we have throughout the pandemic, we'll be driven by data and science on next steps forward. Next slide, please. So with this order, there are essentially 3 orders in place now. There's Denver's vaccine mandate, specifically from the Department of Public Health and Environment. And everyone who falls into that category on the left part of the screen here under that vaccine mandate still has to get vaccinated. If they're not, we have just about 100% compliance now with city employees, and we'll be turning our focus to the private sector to make sure everyone that falls under that mandate is also vaccinated. We have a face covering mandate effective tomorrow. And then from the state health department, there is a proof of vaccine requirement for large venues of 500 people or more. So it's important that we comply with all of this to get through the current crisis. And I believe that's my last slide here. And with that, I'm going to turn it over to Dawn Comstock. Dr. Comstock is the director for the Jefferson County Department of Public Health.
Hello, everyone. I'm here today to express my deep gratitude to our regional partners for the efforts that they've taken to protect the residents of their counties, which in turn protects the residents of Jefferson County. We know that lives don't end at county borders, and county borders do not contain this virus. Therefore, it's vital that there are robust protections and mitigation strategies across the board in the Denver metro area. When there are no state orders to protect the people of Colorado, it becomes crucial for us to work together in the metro area to put into place public health orders and guidances that are consistent and uniform whenever possible to create a safer community for all in the metro Denver area. Today, I want to share one heartbreaking statistic from Jeffco that shows exactly what's at stake here. Unfortunately, Jeffco has passed the heartbreaking benchmark of losing 1,000 lives to this disease. Since March of 2021, 1,035 Jefferson County residents have died from COVID-19. That's almost 2 of our neighbors on average dying every single day. That is unacceptable. We cannot continue on this path, especially not when we have safe, effective, low-burden ways to reduce COVID-19 transmission in our communities. Coming together today and implementing these PHOs collaboratively will reduce COVID transmission, reduce unnecessary illness and death, and lessen the burden on our healthcare systems. So again, I thank my partners in the Metro Denver region for taking this step and protecting Jefferson County residents as well as their own. And with that, I'd like to introduce Dr. John Douglas, the Executive Director of Tri-County Public Health.
Thanks very much, Dr. Comstock. It's a pleasure to be here with my colleagues from Denver, where I live, as well as from across the metro region. As Dr. McDonald and Dr. Comstock said, we have been carefully watching the crisis of increasing hospitalizations, increasing deaths, and reduced hospital capacity that we've been facing, frankly, as a state, but very specifically as a region. We have acted a number of times, as Mayor Hancock said, during the course of the pandemic to work together. And over the past week, it became apparent we needed to do so again. Now, as Bob said, we've got the best tool available. We've got highly effective vaccines. We've learned that they can be accentuated by giving boosters after 6 months. And we're making progress. But sadly, that progress is lagging. And a good part of the reason that we're here right now is that lag. There are plans underway to try to increase boosters in Colorado, to increase primary vaccination among those who haven't received it, and to increase vaccination in the newly eligible 5 to 11-year-old kids. But that's not going to be enough, it appears, to stave off the crisis we're facing. We have excellent treatments that are available for those who get sick. Monoclonal antibody treatments, which must be given by infusion or subcutaneous injection, will reduce hospitalization between 70 and 80%. And if we could scale that up in the blink of an eye, we could probably stave off the crisis. But it doesn't look like we can. So as Dr. Comstock said, we really were faced with taking what I think is fairly described as the controversial and unpopular measure of implementing a very common sense prevention tool that we have used off and on through the pandemic, the implementation of requirements for face masking. The Tri-County order that was passed last night for Adams and Arapahoe County by our Board of Health looks very similar to the Denver order. We have tried to be as consistent as possible. We've heard from our businesses, our residents, and our elected officials, please don't do a patchwork. Please do it in common. Please do it as close to each other as you can. Like Denver, our requirement will be all public indoor spaces for folks 2 years of age and older who don't have a medical reason not to wear a mask. And like both Jeffco and Denver, we will be having what we're going to call a voluntary vaccine verification program. So businesses who want to do the right thing by upping the game in terms of having very high proportions, 95% of staff, patrons, customers, et cetera, documented to be vaccinated, don't need to worry about the masks. The reason that scenario can be so effective is that not only is a person potentially infected going to be vaccinated, reducing the likelihood of their transmitting it to others, but everybody else will as well. The Tri-County order is currently intended to be extended roughly through the same period of time as Denver, through the end of the New Year's holiday season. We're currently tying our metric of ending our mask mandate to ICU capacity statistics. We felt that that was a plausible strategy to have people understand why are we doing this anyway. It's not intended to be a forever strategy. It's intended to be something to get us through the worst of the season that we're facing with the understandable desire to get back to normal over Thanksgiving, Christmas, Hanukkah, and New Year's to try to protect our residents and try to protect our hospitals to the best extent possible. Thank you. And it's my pleasure now to turn over the podium to Dr. Robin Wittenstein. Robin is the CEO of Denver Health, just down the street from us, and will address the issue of hospital capacity.
Thank you. And I'd like to start by saying thank you to our partners. The impact of this pandemic on all of us has been incredibly difficult. When we started in March of 2020, facing the first days of COVID, trying to figure out what our life was going to be like and how we could protect people, it seemed like an insurmountable challenge. And yet we came together and we did. We met the challenge. Healthcare workers have come to hospitals, to clinics, to public health arenas for the last almost 2 years, day in and day out, taking care of people who are at an incredibly vulnerable point, frightened, and trying to keep themselves and their families safe. I'm here now to say we need your help. We are at a point of breaking. The hospitals in the Denver metro region are full. We're running 5% of our capacity being available, 5% of our ICU beds, 5% of our medical surgical beds, and not just for COVID, for anything that a patient needs to come to the hospital for. Emergency rooms are routinely diverting patients because they simply don't have the capacity to take care of people who need help. And this is not a sustainable situation. Doctors, nurses, clerks in our clinics, people who serve food and clean the rooms, every single person who has been involved in providing health care over the course of this pandemic are stretched to the absolute limit. They are exhausted, they are tired, and they need the help of the people of the region to get this under control. The idea that we have 80% of the patients in the hospital who have COVID who are unvaccinated, that people have chosen not to get a vaccine and are ending up in the hospital and stressing the healthcare system, is completely unfathomable to me. But we need to make a change now. During the course of 2020 and into 2021, as you know, healthcare services were not as readily available. People were told not to come to clinics, not to come to hospitals, and to wait until we could come up with a solution that would protect them and their families. And now we have one. We're dealing with the backlog of people who need care, who needed care during the course of the pandemic and put it off. They're coming into hospitals now sicker than ever before, and they're coming in larger numbers than we've ever seen before. Our system is on the brink of collapse, and I don't say that to be a fear-mongerer. We truly are at a point where we cannot continue to do what we are doing without help from the people in the metro region. So Bob said this was a difficult decision to make. I'll tell you, it's a difficult decision, but not if you walked into one of our ICUs and saw people gasping for breath. Not if you watched a nurse walk out of a patient's room and break into tears because she hasn't been able to do anything to help them and their family. It wouldn't be a difficult decision if you talked to patients who are afraid to go to a hospital even though they're suffering from a serious health illness, because they just don't know if they're going to be able to leave that institution safely. We need the help of the people who live, work, and play in the Denver metro area. We need to come together to deal with this so that we don't get to the point where a patient walks into one of our hospitals and is told, "We can't help you." That has never been a sentence that comes out of the mouth of a person who is dedicated to taking care of people. Healthcare professionals do not want to say that, but we are perilously close to it. So I ask for everybody to come together to get vaccinated. If you're not vaccinated, to wear the mask, to help us get through the next several months, because my fear is that it would be any one of us who could walk in and could need help. And we'll find that the system that is designed to be there in our time of need is not able to provide what you need. So please, think of the healthcare workers, those you counted as heroes last year, are standing here asking for your help to get through what we're facing. We can't do this by ourselves, and we need everybody to come together. So thank you so much for getting vaccinated and for cooperating with the public health orders. And with that, I'd like to invite Mayor Hancock up to answer questions.
Thank you, Dr. Wittenstein. So as we get ready to go to question Q&A, let me thank again all of our regional partners who are here and for your conscientious efforts to help us as a region really begin to address this critical point that we're at. We are at an inflection point. And I hope you heard, particularly through Dr. Robin Wittenstein's comments, that our unvaccinated are driving our hospital system to the brink of breaking. And it's something we simply cannot afford. Not only folks who are impacted by COVID, but folks who have other health challenges will be impacted if we arrive at that point. It's a key metric that we look at. And as a result, we're coming together as a region to form this mandate, this public health mandate, vax or mask, and requiring our venues, our public venues, to institute a vax check system for every patron and customer, or requiring everyone to wear masks. And with that, we will go ahead and open up for Q&A.
Alrighty, I'm gonna go in order of those that I checked in. Please remember to unmute yourselves, and we would ask that you please stay on the topic of today's announcement. First up, we have Meg with Denver Post.
Okay.
Go ahead.
Hi, this is Meg Wingeter from the Denver Post. My question is about if there's any kind of estimate of what this metro area mandate would do in terms of protecting hospital capacity, knowing that the rest of the state is not doing the same.
The best solution would be for the entire state, in fact, the entire country, to have a vaccine mandate that would call for everybody to get vaccinated. Absent the ability to do that, what this will do is it will reduce transmission rates and will help to we believe, take some of the increases that we're currently seeing and help to reduce those. As I said, the healthcare system is on the brink of collapse. We are literally full every day. And at this point, it's not just about COVID. We certainly have a number of COVID patients in all of our hospitals. It's about making sure that we're protecting the ability of hospitals to be able to take care of both COVID and non-COVID patients. The last thing that I think any of us want to face is making a call to 911 and having to be told that the hospital nearest to you is full and can't take any more patients, and we're going to try to figure out where to send you. This vaccine mandate, the vaccine passport, plus the combination of masking if you are not vaccinated, will reduce transmission, and that should reduce the number of patients who are hospitalized in our institutions. Thank you.
All right, next up, we have Rebecca with Colorado Public Radio.
Hi, I'm Rebecca Spies with Denverite and Colorado Public Radio. I was hoping to get a little clarity on the different end times and the different measures that you're using. Denver's ends on January 3rd.
Rebecca, you cut out.
Yeah, okay, I heard a part of the question about the timing of the mandates. I believe in Boulder County, Boulder County already has this system in place. Jefferson County Board of Health, this was mentioned earlier by Dr. Don Comstock, they approved this yesterday. I believe it goes into effect tomorrow. Denver's goes into effect tomorrow, and I believe that's the same with Tri-County Health Department. Most of the mandates will end the early part of January. But I think we all would reserve the right to evaluate data and make the right decisions at that point. So,
Rebecca, did you get back on?
Yes, I did. Thank you.
Okay, cool. Alrighty, did that answer your question?
Sorry. Let me listen.
Okay, we'll get back to you. Let us know if you have another question. Next, I have Raphael with Univision.
Yes, good morning to all. I'm pretty sure these changes must be implemented in bars and nightlife venues. What is your message? I don't know if maybe the mayor or someone else could answer it. What would be your message to those business owners, and what are you expecting from them regarding these changes?
As well. I'm glad you asked that question. It's a very good question, and what we're asking folks to do is to help us to save lives, to save the lives of their employees and their patrons, and to help join in our efforts to make sure we protect the capacities within our hospitals. Again, either implement a VaxCheck system. Many of us today have on our phones and our persons our vaccination records. They're easy to upload from the state. If you haven't done so already. And if you don't want to do a VaxCheck system, if that's something you prefer not to do, then you will be required, mandated to put a mask requirement in place for all of your patrons. Is there anyone else who? Go ahead, Dr. Douglas.
Yeah, I just want to echo Mayor Hancock. That would be the two requests we would have of businesses in Tri-County, with one caveat, and that is if you choose not to use a vaccine verification program system, please take the masking part of the equation seriously. There will not be public health folks knocking on doors of bars or police knocking on doors of bars. This is, at least in Tri-County, largely an educational and self-enforcing, complaint-driven with some respects, but it's really an all in this together. So if you're a business owner who is, potentially going to feel inconvenienced by this, please understand the role you can play to try to help Dr. Wittenstein and the other hospitals in the area.
Lexi Nolan with Boulder County Public Health. I'll say that we have rolled out a voluntary vaccination program for our businesses that's been operating for a couple of months now. And one of the things that we find is that the flexibility really allows businesses to cater to their own patrons' needs. And so we have a lot of gyms that have decided that certain classes will be requiring vaccinations, which allows patrons to go mask-free. We have restaurants that require vaccinations. They could be on certain days of the week. And we really think that this provides an opportunity for businesses to pull in more risk-averse folks who don't feel comfortable circulating with a whole lot of unvaccinated people, but would prefer not to wear a mask. And it really creates an opportunity to actually bring in folks who are holding back right now and to bring them into the economy, especially as we go into the holidays, and create some new opportunities. So we encourage that flexibility.
Dawn Comstock, Jefferson County Public Health. Jefferson County also will be working on a complaint-based enforcement basis for this PHO. But what I'd like to tell our businesses is that the people of Jefferson County have already spoken. Over 67%, 68% of Jefferson County residents, all Jefferson County residents from age 0 over 100, are fully vaccinated. Those are your patrons. Those are your customers. So I know you might get a little flack from the one person that doesn't want to wear a mask, but just give this a try. Make one night a week in your restaurant a vaccine-only restaurant night. I bet you'll be full that night. 67% of the people in Jefferson County have told you they want to be protected. So businesses, I don't know, I'm not a business person, but it seems silly to pander to a small number of people that don't want to wear masks and turn off a large number of people that have already told you they want to be protected. Give this a try. I bet it's going to help your business rather than hurt it.
And finally, Bob McDonald with the Denver Department of Public Health and Environment. Every time we issue public health orders, the question always follows, how are you going to enforce this? That's not the goal. The goal here is not to enforce. We've done, since the beginning of the pandemic, over 20,000 visits to provide guidance and to facilitate compliance. But I want to thank every Denver resident, every business owner who's stepped up to do the right thing, who's complied every step of the way. Because a little non-compliance with this virus goes a long way in terms of spread. So in Denver, we will certainly respond timely to complaints. We're going to ask businesses to notify us. We'll provide information to those of you who want to implement a vaccine passport system. We're going to collect a very little bit of information just to have it on record so we know who's doing this. And quite honestly, if we're asked, where are those businesses that have a vaccine passport system in place? We'll be able to share that information. So we'll be watching this closely. We'll be monitoring this closely over the next 45 days.
Alrighty, next up we have Marshall with 9 News.
I have kind of a question for the public health directors along the lines of what you've just been talking about, and then if I can circle back with a question for the mayor. But for the public health directors, you're saying vax or mask mandate, but enforcement it's really educational, enforcement's going to be up in the air. What makes tomorrow or any day between tomorrow and January 3rd any different than today?
Well, I'll invite my colleagues to chime in on this as well. We have had a number of businesses that have stepped up proactively and have implemented something just like this. a required mask mandate, or they're checking vaccine documentation at the door. So I want to thank them who did this proactively. What makes a difference between now and the beginning of January is that everyone will now need to do that. All businesses will now need to ensure that everyone in that facility is wearing face coverings, or they will have to check vaccine passports at the door. It's a public health order. We're going to provide guidance. Enforcement is not the goal, but we are going to monitor it. We're going to respond and take enforcement action when we need to make sure that we do have a high level of compliance with what is a public health order.
What I'd like to say for Jefferson County, what makes tomorrow different than today? Tomorrow people can feel safer in Jefferson County. People can feel safer shopping and supporting businesses in Jefferson County. Those people that have not been to a restaurant since this pandemic started can feel safer if a restaurant holds a vaccine-only patron night. Those people that have only ordered online can feel safer shopping in a business knowing that everyone else in that business will be wearing a mask. So what makes tomorrow different from today? Tomorrow, the people of Jefferson County and the metro area will be safer than they are today.
John Douglas, Tri-County, just to quickly add to that, let me clarify one thing. Enforcement is not up in the air. There are civil penalties for blatant disregard of this. That is absolutely not the first push. The first push is educational, and then the response will be complaint-based. But I want to get to your real point, Marshall, which is why would we expect people to behave differently? Let's look around Colorado. Let's look at what happened in Boulder 2.5 months ago when they implemented their mask mandate. And the estimated rate of mask wearing went from about 55% up to the mid 80%. Let's look at what happened in Larimer County about 4 to 6 weeks ago, where the same thing happened and was documented to result, as Dr. Comstock said, in a 30% reduction in hospitalizations. I think our residents, for the most part, will get it if the message of seriousness as conveyed through the sort of remarks that Dr. Wittenstein made, as well as through the reality that this is now a legal requirement. And I think we're going to see some important differences.
And Marshall, you say you had a question for me. Let me also just add, I think the fact that these are largely complaint-based enforcement efforts, that means you've got dozens of eyes and people who are concerned about their own health in your venues and businesses who will know how to make a complaint in the event that they were not asked for vax checks coming in or not required to wear masks. Marshall?
Thanks. There's no eloquent way for me to ask this, but last year we had a news conference. I think it was on a Tuesday, maybe it was Monday. Stay at home if possible, and then you left town. Today you're telling people vax or mask. So personally, for you, if you go to a business and they say mask, will you be wearing a mask? If they allow the vaccine requirement, will you not wear a mask because you're vaccinated? And are you going anywhere for Thanksgiving?
The way I plan to comply, first of all, I'm fully vaccinated and have received my booster shot, and I plan to be wearing masks going in and out of venues from this point as part of the order.
Next question is Seth with the Gazette.
Hi, Seth Clayman from the Gazette. How long do y'all estimate before we'll see the effects of this on blunting hospitalizations, and if it doesn't do enough to move the needle to pull us back from the brink, what is the next step? Thanks.
I didn't hear that. Did you hear?
Yeah. Hi, Dr. Bill Berman, the Public Health Institute at Denver Health. I think the experience from throughout the pandemic and the experience that Dr. Douglas just mentioned from Larimer County suggests we'll see the impact of these changes within just a few weeks.
Any others?
Gabrielle Franklin from Fox 31.
Hey everyone, this is Gabrielle from Fox 31. With the exception of Boulder and Larimer counties, who put their mask mandates into place a little earlier in the fall, I think a lot of people are just wondering why now. We've been seeing cases and hospitalizations rise over the past couple of weeks. So was it just you all waiting for action from the state that never came, or can you speak to why you all are doing this right now?
Yeah, I appreciate the question. I think there are a number of factors that contributed to all of us working together now. We realize that this is a statewide issue, and to the extent that we can take at least a regional approach to address that, we want to do our part. We have been communicating with the state health department to figure out what actions they were going to take. And we also know that these mandates do not come without, they come with inconvenience. We recognize that. And so we don't take it lightly, implementing this type of a mandate. So, I think it's thoughtful. It's the right thing to do. It's temporary in nature, and we know that it will make a difference. Before I forget, I want to ask one other thing of everyone, and that is to don't forget your flu shot. This is not just about getting COVID vaccine shots. It can also help. When you go to get your COVID-19 vaccine, go ahead and get your flu shot as well. That's really going to help out.
Do we have any more questions related to the public health order that we didn't address?
I have one, if you can hear me.
Yep, who's this?
This is Eric Hines with Business Den.
Go ahead.
I was just wondering whether or not people who are unvaccinated can still wear a mask in a place that requires the vaccination passports. I just wanted to get clarity on that.
Thank you. The way we run our program in Boulder, and I believe it's pretty uniform in the adoption of the voluntary vaccination program, is that if a business wants to implement the program, the vaccination verification program, they have to have a plan for verifying that 95% of the people that are coming in are vaccinated, in that case, someone who was unvaccinated probably wouldn't be let in. To be very clear, you can always mask in a vaccine-verified facility, but you also have to be vaccinated. In any business that is not part of the vaccine verification program, you need to mask whether you're vaccinated or not.
Anyone else we missed?
Let me thank everyone for joining us today.
Go ahead, Colleen.
I was just wondering if anyone could give me a sense of what percentage of people who are in hospital ICU beds in the Denver area are from the Denver area, or are they from out of beyond the region?
This is Robin Wittenstein. We don't have that information. I'm sorry. I will tell you, though, that the pandemic is impacting every area of not just Colorado, but the states around us. And there are routinely calls coming into all of the Denver area hospitals from institutions around the state and around the neighboring states, asking for us to be able to take transfers from other areas. Unfortunately, with the capacity issues that hospitals have, it's almost virtually impossible to do that. And we're seeing this play out across the country, that hospitals are filling up and then are turning to others and asking them to take admissions. And it's become a case where patients are sometimes hospitalized hundreds of miles away from where they live. But I don't have the specific information on the percentage of ICU patients that are from the Denver region.
Just want to make sure we didn't miss anyone that started or jumped on after we started.
Yes, Jason Grenauer from Denver 7, if I could ask a quick question.
Go ahead.
It sounds like many of you were waiting to see what the state was going to do. Did the lack of any kind of mandate from the state level or the time that passed while the state was deciding cost Colorado time in getting to this point? Also, I mean, you answer the why now, but that in the meantime, while you were waiting on the state, did that cost Colorado time, and now we're at the point where our hospital systems are on the brink of collapse?
Let me be clear. We work very closely with the state CDPHE as well as with the governor's office, and have remained in communication with both the governor and the CDPHE over this entire time. The governor knew exactly what he needed to do and followed through, at least with the larger venues. And this was something in terms of the regional effort around the smaller venues was something that was under wraps, or at least being worked on behind the scenes for quite some time. Needing to do this and needing to act as a region, at the very least, to act as a region. And you know, the time that we took was one that was important because we got the region lined up to move forward, and I think we're going to be much more effective. Obviously, I don't think anyone here would argue. We would prefer to have done this a couple weeks ago, maybe 3 weeks ago, but it takes time to make sure we're all aligned. We're not all created the same in terms of our governance structure, and so it takes time for us to get to where we need to go, but the reality is we're here now, and we need folks to comply with this mandate so that we can get folks safe, and we make sure that we protect the capacities within our hospitals to serve all patients, whether they're COVID-related or not. Thank you all very much for their time. Thank you again to our regional partners.